Well, ladies and gentlemen, for our final healthcare fireside chat. Now, this fireside chat is going to be about protecting critical data with cybersecurity for healthcare organizations. We're looking at talking about patient data, of how to keep your records safe, latest cyber technologies to combat increasing cyber threats, and cyber incident recovery effective strategies. Well, the panelists for this upcoming fireside chat, first up is Mohamed Gamal, the Director of IT, Head of Information Technology, Zahra Hospital, UAE. Well, Mr. Gamal is dedicated to improving primary care practices to facilitate quality improvement at Al-Zahra Hospital and medical centers that can help practices improve the ability to deliver high quality care and improve patient outcomes. He's somebody who's a recognized expert in health IT development and a use of IT clinical practice with transforming IT quality improvement. Also joining us would be Abdulaziz Alkhlaif, the Chief Information Officer, Dr. Abdul Rahman Al-Mishari Hospital, Saudi Arabia. Well, Mr. Abdulaziz is a Chief of Information Systems and work in the hospital and the healthcare field. He's somebody who's a master in strategic governance, project management, business and systems analysis, improvements in all the IT management aspect. And the moderator of this fireside chat is going to be Ramakrishnan Natarajan, the Vice President of IT, Emirates Hospitals Group, UAE. Mr. Ramakrishnan is an IT thought leader with over 16 years of experience in various spheres of solution delivery, operations management, enterprise architecture, and information security within multiple industry sectors, including system integrators, aviation, banking, and government, currently leading the way in healthcare. So, ladies and gentlemen, with this, I'd now request our eminent panelists, as you can see them on the stage and screen, and I'd like to now pass the live baton to Mr. Natarajan to take it forward with his fireside chat with Mr. Gamal and Mr. Alkhlaif. Over to you.
Thank you so much, Soundarya. In fact, I would like to start by thanking Trescon Global for organizing this wonderful World Cybersecurity Summit, MENA. It is a privilege to be moderating this panel among our esteemed speakers. I am actually heading the IT of Emirates Hospitals Group, which is basically a heterogeneous cluster of hospitals, clinics, rehabs, day surgery centers, and pharmacy, among others. I would like to start this by saying that the patients actually rely on healthcare providers like us for their medical needs, and they trust us with their health. And that doesn't end there. They also trust us with their data. They trust us with their medical information, and they trust that it is safe with us. But if this data is breached, it does impact the other trust as well. So it has definitely a business impact. And especially during the COVID times, we have seen the rise of attacks based on fake informations and a lot of other risks which were luring among the end users and the patients themselves. Unfortunately, the more healthcare hacking incidents are happening, and unauthorized access are increasing each and every year. Now, considering this growth, the growing trend of cyber attacks, I would like to base my first question, and I would like to direct it to Mr. Abdulaziz. What do you think, with this growing trend of attacks around the world, what would be the topmost precautions that a healthcare organization should focus on from your experience?
Well, I'd like to start with thanking, of course, the organizer for having us on this panel. We hope to add any value to the discussion. Then I want to respond to your question. It's a continuous battle. Then before COVID, after COVID, and within the period of COVID, the actual burden of keeping the information for patient secure and in the same time accessible is our main objective in any HIT, in any hospital running operation. So the main practice that we will always have, our main objective, is that we don't expose data that are not needed to be consumed. So we will keep those level of exposure to the minimum for the needed. So with this practice, I think we are reducing our service attack when we are addressing the information layer of it. When we are talking about technology, there is of course securing the target and securing the source of those devices that we are connecting to, whatever it is, either server or even endpoint. Those are the main two practices that we always keep in mind to make sure that we are not restricting something that need to be exposed, and we're not exposing something that need to be restricted. I hope that I answered the question.
Thank you so much, Mr. Abdulaziz. I think that was very well articulated, short and sweet. And you really touched upon some key points where basically the CIA triad, where availability is also one of the major factors. So things that should be available should not be restricted, and that should be restricted should not be made available. It's a very delicate balance that IT leaders should focus their strategies on. I think I'll moving on to Mr. Mohamed Gamal. I would like your views on the same. You're on mute, Mr. Mohamed.
Thank you very much for inviting me today. I'm really enjoying this meeting and this discussion. I agree also with Engineer Abdulaziz. I just wanted to add the executive leadership and the strategy is also very important here, and the key point to success to improve the confidentiality and security for healthcare data. Especially nowadays where we have increase of digitalization and lots of initiative for IoT implementation. We have now, especially from the COVID, since it started last week, we can see a new service or a provider who's struggling to initiate the service before. Now it's easy for them and self-justify to the management that we need to go for telemonitoring or home care devices or teleconsultation and wearables. So starting with executive leadership, that they have to appoint a responsible and a dedicated team to look after the security is something become essential, whether for acute or non-acute provider. And we have seen also the recommendation from HIMSS 2019 about what is the number of CIOs or number of team dedicated for security is not as expected. So strategy is also important. And since we are working in a very dynamic industry, healthcare is not a fixed industry like a construction. We have also to be dynamic. It's not like something we have to design it first and then go through it for the next 5 years. No, we have to also look each and every now and then to see how we can change this strategy according to the situation, according to the need from different perspectives.
Thank you, Mr. Mohamed. So, to be frank with you, like coming from a group which has which has multiple types of entities, including clinics, hospitals, and whatnot, I really understand what you are saying, because the security strategy differs from organization to organization. It differs from entity to entity. So it has something that should be elastic, but however, it should focus on reducing the risk and should be easily implementable. So that is something we need to always take into account. And there are a few things which I believe that that the CIOs should focus on, which are the most basics. Starting with COVID-19, we have seen the huge increase in the number of remote access users. So at this point of time, maybe some of the precautions that could be taken is going for a solution, for a secure remote access solution that includes a zero trust model, and it's able to identify who, what, where, and when are the remote users accessing from. And second, we do see a huge surge of increase of privileged users, like you call it help desk admins, application developers, database admins, service accounts from machines, and of course, as you mentioned, IoTs. So a very unified approach to privilege access management is one of the key things I believe can be taken as a precautionary measure. And again, like one of the key things that our previous panel was discussing, it's about the educating our staff on cybersecurity, which is one of the key factors, as they are our the first line of defense, and as most of the attacks happen from from the end user part. But however, I do feel that there should be a balance between automating these security, so that the pressure on the end user is not as much, and to allow these technologies. Of course, there are latest trends of AI and machine learning technologies, which most of the new solutions are implementing nowadays, can be utilized. Going ahead from this, let me come back to what do you think would be the strategic information security initiatives that healthcare CIOs should spearhead to ensure long-term robust information security maturity model or maturity scoring. Let me put this across to Mr. Abdulaziz first.
Well, when we are talking about maturity, we should consider the 360 view of it. It's not only maturity in the administration side; it's also maturity on the adoption from the staff and the end user, the clinician, and others. So, as you have mentioned, awareness and education about the subject is a major key that we have to strike twice and third time every year. As majority of people that work in hospital knows that we have a dilemma of those retention of those staff. So we have continuous change all the time. The people coming in, coming out. It's a dynamic workplace that's always changing, and we are always going to have that challenge. Now the trick is how to establish that culture, so we could have a culture of at least what do you need to know related to securing your end. Now that is the key to start this discussion. When you are building awareness about security, we should not look at it from a security officer point of view or a CISO point of view. It's nothing to do with their side of the security. It's everything to do with the end user point of view. So I'll give you an example. 2 years ago, we started a small orientation session that is completely online. We will keep up reminding people to go through this program. It's 4 to 5 videos, small video to 2 to 3 minutes. And then a small questionnaire after that. How do you observe the material, and do you understand what is expected to be done from your side? It's all about securing your end as an end user and using the end device. It's securing your email, your behavior into putting your information online, maybe a little bit for their concept of purchasing online and keeping your identity safe. So those practices mainly is helping the end user, but it does have a huge impact that they are aware about the risk that they are going through as soon as they go online or as soon as they access sensitive information for the patient remotely. And you touch on this with COVID. Of course, there is a need to have remote accessibility for our employees and staff working either from home or somewhere else. But also having that as part of the design when you're starting designing your infrastructure, your architect itself, is going to be a key differentiator for you. You know, it's not an afterthought that you say, okay, once we get there, we'll use, one type of remote desktop to access so and so. That should not be the case. You need to tailor your own technology, your own solution for what are you using right now, and then the need of those, you are serving and providing access to. So that should not be an afterthought. The education part is huge and important for also moving forward. I think the language is the third point that I like to point out. The language of communicating on this subject should not be technical. It should be relevant to the end user, so it will have more adoption in the data stage. Thank you.
Thank you, Mr. Abdulaziz. I think that was, an excellent point. And going back to, I have been watching the panel, several panels today, and in one of those panels, one of the key points that was raised was the confidence of the end user to bring something to the attention of the information security staff or the IT staff, for that matter, is something that comes with training, with constant education. Certain things that they are not very well aware can very well be, referred to the IT department, where the information security team can review and assess the risk and take actions thereof, or advise the user for further actions. And constant awareness program is definitely the key to a robust security mechanism in a healthcare industry. Completely agree with you, because of the kind of data that we deal with. We deal with patient data, patient medical records, which should not ideally be sent out of the country, and should not be shared on social media, and even accidentally. So the infrastructure, as you mentioned, should be built in a way that that by default prevents accidental actions as such. And combined with the information security awareness, they will definitely provide a robust backbone for a secure healthcare environment. And going back to Mr. Mohamed, what is your take on this topic?
I completely agree with the same point that we have to be careful about how about the human error and the intentional insider traits, because it's not fair to expect everyone to understand the information security and how the data is classified and categorized, same like IT or the owner of the data or the one who's managing this data. So even according to the recent study, we can see the high percentage when it comes to the phishing attack, for example, or man in the middle or malwares that people are receiving this kind of attack, and you rely much on their actions. And if they don't understand very well how to use this data, then it could turn to a disaster. What I like about IMRAM survey last year, which is the scoring mechanism changed, that they have added some points for MR security, that the IT leaders have to evaluate, I have to deliver a training and retraining for existing provider, even nurses and physicians, 2 times a year. Even though I arguing with them that this is tough, how it's difficult to pull a physician and nurses to deliver a training 2 times a year. But still, I agree with them. We can think about privilege misuse and lost and stolen assets, or web threats, or web threats, which is coming basically from the user. It's very important to deliver this awareness to the end user as well, along also with the executive leadership. And I want to include also how we manage the endpoint security, which is very important. We can see lots of use of connected medical device in healthcare, and how this grown dramatically because of the recent changes, whether COVID or other integration requirements. Further also increasing the industry vulnerability from outside. And this point will take us also to how we are managing the third-party security risks, and how many machine in the lab or radiology or vital signs connected to our system, or even partner or clients who have system from outside and directly connected to the provider network for bidirectional or unidirectional integration. Do we have a strategy how we can maintain this? Do we do are we doing a continuous assessment for their security? Do they have the right resources who securing this data? Do they have also a contractor who maintain their security? So we're not only talking about the third party security, but we're talking about the fourth party security risk or more. Not to forget also how we get the executive buy-in security awareness training. And this is very important. We design our budget every year, and we put something related to security, whether to endpoint protection or this software or this system or this awareness program or this training. But if the C-level executive, the CFO, CTO, CEO, COO, who I'm reporting directly to or who's involved in this project does not understand how the important is security for the organization, then it's useless. We have to get them involved with more influence and give them wider training and give them the better access to even this resource. Show the reports if the IT have identified the risk to the organization or weakness in the organization, better to show this in the reporting and to highlight, visualize, so you can get their attention and also get their involvement to support.
Thank you, Mr. Mohamed. I think you have brought in some enlightening views on this topic. First of all, as you said, it's not easy to get the clinical staff to attend a dedicated training. And one of the ways that I think we are addressing that is to have maybe a self-paced training or a training for the staff who can attend and have a recording of that so that it has a human touch. And at the same time, sometimes if have to attach it to some kind of KPI for the managers and for the HODs. So this is one of the way, and of course, the executive buy-in is one of the most important thing that without that, it's not easy. And one of the approaches I saw in one of my previous organization is basically a kind of a cost-benefit analysis, which is not an easy task. You need to assess the cost of breach for each and every of your asset. Either you take it from an asset perspective or you take it from an application perspective. It is something very difficult, but it can be done. And if that can be done, each and every expenditure can be financially, depicted, and which will make more sense to the CXOs. I believe one of these approaches could be taken. And secondly, one of the initiatives that I believe that can be taken is to definitely have a security governance model in place, which is headed by a information security steering committee, advisory forum, and a communication network, which involves, as many of the panelists have already iterated, a top-down approach, where that adds more credibility to the initiative. And when the reporting goes directly to the CXOs, that definitely brings up more adoption levels from the staff members and more cooperation. Let me go to the next topic, which I would like to address is, what do you think are the major challenges we face during implementation of security policies within healthcare? What, according to you, what are the major challenges we face? Let me direct this to Mr. Mohamed.
I think when it comes to healthcare, First, the third-party management and third-party risk, and I'm always mentioning this because this is kind of a hidden risk. I have seen lots of issues in operationally because lots of machines or even vendor or data breach, which is exchange between the providers and the contractor, partner, or patient because of lack of awareness or governance, how to maintain this part. Again, another one is because of the nature of the business, as we just rightly mentioned, how to get the clinical team involved on the security awareness and the training is always a challenge, but there is a standard or a methodology to follow how to deliver or push the content and get the acknowledge about the security awareness and training to your users or the one who's using your system or the HR or HIS system. I think also the budget and the cost of the security tools and security systems, which as IT always something difficult to justify if they are not involved with much or they don't have enough idea how the security threats and risks could affect the organization and the reputation for the organization, then it's a problem. I think should the IT or the people who's managing the data for the organization should have enough fund to support them to secure this data and not to go also extreme, because we can see lots of people, it depends on the target availability target and the risk and confidentiality level for each type of data. There is data which is having really value and with data which is not. So don't come to me and ask for dual firewall for a data which is having only read only on the website. I don't want. I have a backup. This can be enough. So it depends also how they understand the value of this data. I think also employing or at least having a team who look after the security or part of their responsibility is to look after the security and assist this third-party tools or security tools or the getting a feedback for the training deliver, getting involved to for any meeting or any discussion related to data availability, data security is important, not to leave it on the space because there is no attack now or the organization have not faced this situation before. You know, when it's happened, you can imagine how is the impact in the entire organization. So it's yes, it's equal money, and it is very important. So this, I think, the points that should be addressed, and it's a challenge for healthcare.
Absolutely agreed, Mr. Mohammed. Mr. Abdulaziz, as per from your experience, what are the challenges you have faced in implementing security policies in healthcare industry?
Well, I do see a lot of challenges related to change management. People are usually strict in their practices. They like to continue using them until proven otherwise. And changing that require a lot of persuasion, a lot of education. So the human factor is one of the toughest challenges I think security adoption and even any adoption is facing and will face. Until we are at that level of exchanging information and opening that type of dialogue, that whatever being designed for security or for a new adoption of a process is for the good of the organization or the actual enterprise itself, That debate would continue, is that they, as a business side, would like to see the process as fast as they can, without any hiccup, without any bottleneck, without any delays. From our perspective as data management security specialists, we see a little bit, another side of it. So that would be the challenge that I see the most top ranking. And then the next one is, of course, adopting technology for our use. Now, not saying that all technology are created equally, but again, it's the way that we use technology and the flexiness of those solution providers, so they could accommodate our needs. And with with knowledge come the flexibility. So if you interact with somebody that does not know their technology, you will have very strict way to deal with them. And then you're suffering from internally and externally. But with those people that know their craft, you will have more ease and more flexibility. And that is one of the challenges that I see. An available subject experts in the field, in whatever field, is a challenge across the board from any organization. And I don't see having those skilled resources on your side is the way to do it. Subcontracting for those resourceful, knowledgeable partner in the field that will give you that level of understanding and adoption, and then building you that solution that will really fit for your other changing requirement. I think that would be to ease the challenge. I answer this challenge and the way to solve it, but I hope that will be.
No, absolutely. I mean, I think you hit the nail right on the head, Mr. Abdulaziz, because one thing that I would like to advise to the listeners is that if you are managing a healthcare a healthcare industry, the first thing is, if you have not done it before, get a cyber security risk assessment done, and get it done from a reputed vendor in the market, because there is definitely when it comes to the skill set, your organization may not have the required skill set from the various domains of cybersecurity. So it is always better to get at least the initial cybersecurity assessment done, and get it done at least once a year from a third party. So this is something I think I completely agree with you, and definitely partnering with someone who are subject matter experts definitely adds more value to the whole tower actually. So going ahead, I think Mr. Mohamed, you have pointed out multiple times on in terms of the third party that we deal with. We constantly as an organization have to work with multiple partners or collaborate with external parties, whether it is IT services or whether it be supply chain. We always have to do that, and it's unavoidable, of course. How do you think the best practice to assess the risks that they pose, and how do we mitigate them?
I think I would like first to also add a quick feedback about the resources required for to mitigate the security risk on any organization. I do agree that for any organization, they don't need to have a full team or a SOC team internal to mitigate this risk, because this is could not be affordable by all organizations. But from the accountability and the responsibility point of view, someone should be there, not necessary to be a CISO or having this level of certificate or this level of knowledge, but to manage the relation. Security risk is a risk, and there is a technique to mitigate this risk, either to accept it or transfer it. So fully transferring this risk is not advisable But as you mentioned, there is enough tools and systems outside for us that can help us to give us some visibility about these risks inside our network. And linking this also with supply chain and third-party management, I've tried to look in the Ministry of Health and the regulation from DHA in Dubai to see if the security risk is transferable to third party or supply chain, but I couldn't. In the entire regulation, as a provider, you are the only one who is responsible. If you have a SOC team and the SOC team is not doing their work properly, it's still your responsibility. So from this, I think it's first to start with assessment of this devices or supply chain contracts, and for that we have many third party element. If we're not talking about by the way supply chain, we have the clients, the vendors, the partner, and a contractor. And we have to do a proper assessment for the relationship between the providers and these third parties, as well classify and identify, categorize the data from a common terminology of PHI, patient health informatics, and healthcare have specific data security for health information, which including the medical history and the records for these patients, including also the biographic information and financial information. There should be a proper risk assessment for this information, which identify the type of vendor, the type of contract between me as a provider with this vendor, the security assessment, when we can review this assessment, this security, even if, as you mentioned, if there's penetration tools, we should include this integration in our penetration to see whether the data is going out directly to one point or multiple points. If this data is tunneled and encrypted enough, there is no man in the middle or attack could happen. And we should know both existing and potential vulnerabilities from this integration. Plus also, of course, tracking all these changes and monitoring continuously to see how this is healthy. Often the third party can be assessed. This is depend on the contract, but I think every 3 months, every 4 months should be conducted at least between the providers and the supply chain or the contractor to assist and continue changing this agreement.
Thank you, Mr. Mohamed, for that enlightening views on how to manage third party. I agree with all your points on that, and I would like to give the control back to Bhavna, as we are almost out of time here. Thank you so much, everybody. It was a pleasure and honor to be speaking along with you.
No, absolutely, Mr. Natarajan. Also, I'd just request Engineer Abdulaziz, Alkhlaif, do you have any closing remarks from you as well as Mr. Gamal? I know we're really extending on the time, but with such experts, Mr. Natarajan, it's best to give them another 10 or 20 seconds each. So I just
absolutely
Engineer Alkhlaif for your closing notes as well. Over to you, sir.
Thank you for allowing us to conclude. I think the main obstacle that we are facing with adopting more security that is flexible and accommodating to the business side is the knowledge transfer that every security officer or security expert need to extend. It's no longer acceptable that we have to put these policy in place just because. It's always going to be a debate between two parties and an agreement at the further point that this is what good and this is what is needed for the business and the continuance of the business in the future. So I hope that this channel will be open, easily accessible from the endpoint people, and all those security experts will be available, accommodating and accepting of the different perspective that people will come to, and then explain and try to figure out what is best for the business. Thank you.
Sure. Thank you so much, Mr. Gamal. Your concluding remarks as well.
I think we all agree that the healthcare industry, based on even numbers, remain the prime hacker target, and healthcare facilities host valuable and marketable patient information. For that, there should be a comprehensive security awareness program that can help healthcare to facilitate and combat many of security concerns. We both agree on this this meeting, the awareness for the end user or the owner of the data, including even the executive, along with securing the third-party tools and the machines and integration we have. It's something hidden always, and it's like a house which is having a very strong and closed door, but still the window is open for attackers and hackers to come inside from this door, and we open it from this window, and we open it with our permission. So that's all from my end.
Absolutely. Thank you so much, Mr. Natarajan. Your concluding remarks. Firstly, an excellent moderation right there. So we'd give you another minute on that as well, because you did such with the Fireside Chat. Over to you, sir.
Thank you. It's a pleasure to be among the esteemed speakers here. And a few things that I would like to add is that cybersecurity has to be demystified. If it has to go from top to the bottom, it can only happen if it's demystified, because people do not understand that. People are afraid, they don't know what to do, what not to do. So it has to be put in a language that they understand, as Mr. Abdulaziz pointed out previously. And second, one point, that this is a continuous battle. It's never going to end. It's a never-ending continuous battle. So we have to keep adopting. We have to keep, updating ourselves. We have to keep strengthening. We have to keep bolstering our security all the time. And one point that we didn't discuss is incidents response. I would like to just add just one point, that incident response we should all be ready with our responses to particular cybersecurity incidents, have our playbooks ready, whether it's manual or automated. But let's start with manual. Once you know that you are capable enough to do it manual, get it automated as much as you can. That would be one of the best steps towards strengthening our security. Thank you so much.
Absolutely. Thank you so much, Mr. Natarajan, Mr. Gamal, Mr. Alkhlaif, Engineer Abdulaziz Alkhlaif, for joining us and giving us your valuable time. What a concluding Fireside Chat that was. We at Trescon Global value your experience and expertise, and we thank you for your time. Thank you so much.
Thank you.
Thank you. Thank you very much.
Thank you. God bless. Cheers.